Spot these 8 early cancer symptoms. They could save your life. Did you know that 1 in 3 people will develop cancer in their lifetime? That's a staggering statistic. But here's what most people aren't paying attention to. Every year, millions of cancer cases are diagnosed too late, simply because people miss the early warning signs. According to the American Cancer Society, catching cancer in stage 1 can mean survival rates above 90% for many common cancers. However, if you wait until stage 4, that number can drop below 20%. This highlights the critical importance of early detection. In fact, studies show that if cancer is caught early, treatment options are far more effective, and survival rates are significantly higher. Early detection truly changes the course of the disease, and that's why this information is so important. The unfortunate reality is that many people are unaware of the early signs of cancer, and often mistake them for less serious health issues. In the next few minutes, I'm going to share 8 subtle warning signs that could literally save your life. These aren't the obvious symptoms that everyone already knows about. They're the quiet signals your body sends before things get serious. Most people overlook them completely, but they could be the key to early detection. The information I'm sharing is grounded in science, backed by clinical research, and it's not based on internet rumors or health myths. Now, I know what you're thinking. Every little ache or pain could be cancer, right? That's a common concern. But that's exactly why this video is different. We'll focus on scientifically backed warning signs, not internet myths or vague anecdotes. These are the signs that have helped thousands of people catch cancer early when treatment is most effective. They're the ones that medical professionals, researchers, and cancer survivors recommend paying attention to. It's not about scaring you. It's about arming you with knowledge that could make all the difference. Since this topic is so important, I've created 2 more in-depth videos that you might want to check out after this one. But for now, let's dive in. Attribute number 1. Persistent bone pain. One of the most overlooked signs of potential cancer is persistent bone pain. Unlike the temporary discomfort from exercise or minor injuries, cancer-related bone pain tends to intensify over time and often becomes more pronounced at night. When cancer originates in or spreads to the bones, it disrupts the normal bone tissue structure, causing a deep, penetrating ache that is difficult to ignore. Primary bone cancer, known medically as osteosarcoma, typically affects the long bones of the arms and legs, and the pain can initially feel like a sprain or muscle ache. Over time, however, the pain gradually becomes more severe and constant, affecting your ability to carry out daily activities. According to the National Cancer Institute, bone pain related to cancer may worsen with activity and can become particularly troublesome at night, making it difficult to sleep. What makes this concerning is that it may begin subtly, often being mistaken for a muscle strain or a simple injury. However, the pain won't improve with rest or over-the-counter pain medications like typical injuries would. Some people describe the sensation as a dull, throbbing ache that doesn't go away. In some cases, bone cancer can also cause swelling, tenderness, or even visible deformities. If you notice bone pain, especially if it's persistent and not related to any injury, along with unexplained fractures or swelling, it's crucial to seek medical attention promptly. Why this matters? Early detection of bone cancer can significantly improve survival rates. According to studies published in the Lancet Oncology, survival rates for bone cancer are much higher when diagnosed in the early stages, before the cancer spreads. This is why paying attention to bone pain, especially if it's persistent, is so important. Ignoring the signs could delay treatment and worsen the prognosis. Attribute number 2. Unexplained eye pain or changes in vision. Your eyes can reveal crucial information about your overall health, including potential signs of cancer. While many eye problems, like dryness or irritation, are not serious, certain eye symptoms could indicate something more alarming. Ocular melanoma, for example, though rare, is the most common primary eye cancer in adults. This form of cancer can be difficult to detect early, as the symptoms often develop gradually, but if noticed, they should not be ignored. Symptoms like blurred vision that doesn't improve with new glasses or strange flashes of light that can't be explained by migraine headaches are often red flags. A common sign of ocular melanoma is the appearance of a dark spot on the iris, which gradually changes in size or color. This change may be subtle at first, but over time it can become more pronounced. The American Academy of Ophthalmology emphasizes the importance of regular eye exams, particularly if you have risk factors like a family history of eye cancer or if you have light-colored eyes or fair skin, which increase your risk of developing ocular melanoma. Advanced imaging techniques, such as ophthalmoscopy, allow doctors to examine the internal structures of your eye and detect abnormalities that could indicate cancer. Why this matters? Early intervention can preserve both your vision and your life. If left untreated, ocular melanoma can spread to other parts of the body, making it harder to treat. According to the Journal of Clinical Oncology, survival rates for ocular melanoma are higher when diagnosed early, and it is possible to treat the condition effectively if caught before it spreads to other areas like the liver. Don't wait for symptoms to worsen. Schedule an eye exam if you notice any changes in your vision. Attribute number 3. Skin rash or unexplained bruising. Certain types of rashes and skin changes deserve immediate medical attention, especially when they appear suddenly and don't go away. Leukemia, a cancer of the blood and bone marrow, can sometimes manifest through distinct skin symptoms that are often mistaken for more benign conditions. Petechia, tiny round spots that appear on the skin, result from a shortage of platelets, a condition known as thrombocytopenia, common in leukemia patients. These spots don't blanch or fade when you press on them and often appear in clusters on areas where pressure is applied, such as the ankles or around tight clothing. Leukemia disrupts the body's ability to produce healthy platelets, which are essential for blood clotting. Without enough platelets, tiny blood vessels called capillaries leak blood into the skin, causing these characteristic spots. These rashes are typically red, purple, or brown in color, and unlike normal rashes, they do not fade away after a few days. In addition to petechia, leukemia patients may experience unexplained bruising or bleeding, frequent nosebleeds, or bleeding gums. Why this matters? Leukemia can be a rapidly progressing disease, and early treatment is essential for improving outcomes. The American Cancer Society emphasizes that the earlier leukemia is diagnosed, the more effective treatment options can be. If you notice a persistent rash or unexplained bruising, don't wait. Consult a healthcare provider right away. Attribute number 4. Unexplained night sweats. Night sweats that drench your bedding in sweat can signal something more serious than just a warm room. When these episodes occur repeatedly and are not related to environmental factors or menopause, they could indicate lymphoma, a cancer of the lymphatic system. Lymphoma-related night sweats are often described as drenching sweats that occur without any obvious cause, and they typically happen alongside other B symptoms, which include unexplained fever and weight loss. This combination of symptoms should never be dismissed as something trivial. The sweating occurs as your body works over time to fight off cancer cells. According to a study published in Blood Advances, lymphoma can trigger the immune system to release chemicals called cytokines, which disrupt the body's temperature regulation. This results in episodes of fever and night sweats. Unlike typical night sweats that occur due to environmental factors or stress, lymphoma-related night sweats tend to happen regularly, leaving you drenched in sweat. Why this matters? The earlier lymphoma is detected, the better the chances of effective treatment. The Journal of Clinical Oncology reports that lymphoma is more treatable in its early stages. If you're experiencing persistent night sweats along with other symptoms like unexplained fever or weight loss, seek medical attention promptly. Attribute number 5. Persistent heartburn or difficulty swallowing. Chronic heartburn or gastroesophageal reflux disease, GERD, might seem like a mere inconvenience, but when it persists despite lifestyle changes and medication, it could signal something much more serious. Esophageal cancer, for example, often first manifests as persistent acid reflux that doesn't improve with treatment. Over time, repeated damage from stomach acid can cause changes in the cells lining the esophagus, leading to a condition called Barrett's esophagus. Barrett's esophagus is a precancerous condition that significantly increases the risk of developing esophageal cancer. Why this matters? If you've been dealing with heartburn for several weeks or months and over-the-counter medications aren't helping, it's important to consult a doctor. The American Journal of Gastroenterology notes that untreated GERD can lead to esophageal cancer over time, especially in people with additional risk factors, such as obesity, smoking, or a family history of the disease. Early intervention can prevent the progression to cancer. Attribute number 6. Jaundice. Jaundice is a condition characterized by the yellowing of the skin and the whites of the eyes, and it often signals a problem with the liver, pancreas, or gallbladder. It occurs when a substance called bilirubin builds up in the body, and in adults, its sudden appearance can be a warning sign of pancreatic or liver cancer. Pancreatic cancer, in particular, is known to obstruct the bile duct, which prevents bilirubin from being properly processed and expelled. As a result, the excess bilirubin enters the bloodstream, causing the skin and eyes to turn yellow. Why this matters? Pancreatic cancer is notoriously difficult to detect early, and jaundice is one of the few signs that can help doctors diagnose it before it spreads. According to research published in The Lancet, early detection of pancreatic cancer is crucial for improving survival rates. If you notice any signs of jaundice, such as yellowing skin or eyes, dark urine, or light-colored stools, seek medical attention immediately. Attribute number 7. Sudden weight loss. Unexplained weight loss can be one of the earliest signs of cancer. While many people associate weight loss with diet or exercise, if you're losing weight without trying or without any apparent reason, it could be a warning sign. Certain types of cancers, such as pancreatic, stomach, or esophageal cancer, can cause significant weight loss, especially in the early stages of the disease. This is often because the body uses up more energy trying to fight off the cancer, which results in unintentional weight loss. Why this matters? Unexplained weight loss is often an early indicator of cancer and should be investigated further. According to the National Cancer Institute, cancer-related weight loss, known as cachexia, can occur in the early stages of many cancers. If you've experienced a sudden, unexplained drop in weight, it's important to consult a healthcare provider. Attribute number 8. Persistent fever. Fever that persists for no obvious reason, especially when accompanied by other symptoms like fatigue, weight loss, or pain, can be a sign of certain types of cancer, including blood cancers like leukemia or lymphoma. These cancers can trigger your immune system to release inflammatory chemicals that lead to a persistent fever. Unlike fevers that are caused by infections, cancer-related fevers don't respond to typical treatments and can last for weeks. Why this matters? Fever can be an early symptom of blood cancers, which require prompt treatment. Early detection of leukemia and lymphoma can significantly improve survival rates and treatment outcomes. Conclusion: remember, early detection dramatically improves cancer treatment outcomes. While these signs don't automatically mean you have cancer, they deserve proper medical attention. If you notice any of the symptoms mentioned, don't wait to seek medical help. Thank you for watching this video. Please give it a thumbs up and share it with others who might benefit from this knowledge. Don't forget to subscribe to our channel for more informative health content. If you found this video helpful, be sure to check out our other videos on the screen.